Remember Mpox? That outbreak back in 2022?
Yeah.
Well, it's back in the news.
Hmm.
This time, things are a little different. Some pretty big developments, actually.
Okay.
We're going to take a deep dive into some new research from the Technical University of Denmark.
Right.
And get this.
Yeah.
It was just published this week.
Wow.
February 24th, 2025.
Hot off the press.
They've been tracking a new Mpox variant, and what they found is, well, it's a game changer.
Wow, it definitely changes how we thought about the virus before.
Right. So this new variant, they're calling it Clade 1b,
Okay.
and it's spreading much faster than the Mpox we saw in 2022.
Interesting.
And get this.
Yeah.
It seems to be spreading mostly through heterosexual contact,
Really?
not primarily men who have sex with men, like we saw before.
Oh, wow. That is a really important point.
Yeah.
Yeah, because it means the virus is changing.
Right.
Like how it behaves. Right.
It's a good reminder that we need to be flexible,
Yeah.
in our understanding of it, and adapt as we learn more.
Absolutely. And this research team
Yeah.
in Denmark, they're doing amazing work.
Yeah.
They've been tracking this new variant,
Okay.
Clade 1b, all the way from its origins in the DRC.
The Democratic Republic of Congo.
Yeah.
Wow.
To other countries. I mean, that's some serious detective work.
That is.
They even developed a new PCR test
Oh, wow.
just to identify this Clade 1b.
That's amazing.
So we've got this faster spreading variant moving in new ways that we haven't seen before. So what does that actually look like? I mean, on the ground, well, they found cases in neighboring countries to the DRC.
Right.
And internationally, places like Sweden and Thailand.
Wow.
So this isn't just a regional issue anymore. No, it's a great example of how interconnected everything is.
Yeah.
A virus can start somewhere and then quickly become a problem everywhere.
Right, exactly. And unfortunately, there's more.
Oh, no.
This is where things get a little unsettling.
Oh.
The research points to a possible connection between this new variant and miscarriages in pregnant women.
Oh, wow.
Yeah.
So the data suggests that women infected with Clade 1b may have a higher risk of miscarriage.
Right.
It's important to note that this is preliminary.
Of course.
This is early data, but it's concerning enough to warrant further investigation.
So let's bring this back to you.
Okay.
What does all of this mean?
Yeah.
Practically. Well, the researchers, they're really pushing for more awareness.
Okay.
Especially in those high-risk areas.
Makes sense.
And they're urging people to take preventative measures.
Good idea.
And what I find fascinating is they're stressing the importance of avoiding close contact, especially sexual contact, in areas where this Clade 1b is circulating.
Yeah.
So simple preventative measures can really make a difference in slowing the spread.
I mean, for sure.
For sure.
Yeah.
And speaking of being in the right place at the right time, did you know these researchers are part of a project called Great Life?
Oh, interesting.
Their mission is to build up the capacity
to
detect and respond to disease outbreaks in East Africa.
That's a great point.
Yeah.
Yeah, the fact that this project was already happening when this new Mpox variant appeared, it's remarkable. They were already there. They already had expertise and resources to track the spread and even develop that new PCR test.
Right.
That kind of rapid response is so crucial.
Absolutely. So their quick action means we have a much clearer picture of how this variant is transmitted and the risks it poses, especially for pregnant women. So I'm wondering, could this be a good example of how investing in global health infrastructure can really pay off?
It makes a strong case for it,
Right.
And, we're seeing cases as far away as Sweden and Thailand. That really shows you how quickly a virus can spread.
Yeah.
These days, it emphasizes the need for global cooperation and being vigilant in monitoring and responding to these emerging health threats.
Absolutely. So we're getting a pretty sobering picture here, but I think it's important to highlight the power of scientific collaboration and rapid response. They were able to identify this new variant. They tracked its spread, developed a new test, in a remarkably short amount of time.
That's a real testament to the dedication and expertise of these researchers. Yeah. And, their findings, they kind of remind us that we can't be complacent when it comes to infectious diseases. Right. Because they can evolve and spread really quickly. Yeah. So we need to be ready to adapt and respond.
That's right. And what's really striking is, unlike in 2022, this new variant is mainly spreading through heterosexual contact.
Wow.
And it's impacting a wider range of people.
Okay.
We're talking densely populated areas, healthcare workers, even children.
Wow.
So this isn't just a repeat of what we saw before.
No, you're right. The virus has mutated.
Yeah.
And it's behaving differently. So we need to change our understanding and our approach.
Right.
The high number of miscarriages.
Right.
In infected pregnant women, that's particularly alarming and definitely needs more investigation.
Absolutely. Now, the researchers, they're calling for more. Yeah. Cross-border collaboration. Okay. Increased vaccination efforts. Right. And public awareness campaigns.
Makes sense.
They're even suggesting travel advisories.
Wow.
Against visiting high-risk areas and engaging in sexual contact. Okay. In those affected regions.
That's a pretty strong recommendation.
It is.
I think it reflects how serious the situation is. Right. They're really urging people to be careful. Yeah. To avoid close contact, especially sexual contact. Yeah. In areas where Clade 1b is spreading. Right. It's a good reminder that even simple things can have a big impact on stopping the spread.
So it's interesting. They found this connection between the spread of the virus and sex workers in densely populated areas. Okay. It highlights how important it is to reach out to these communities. Right. Provide them with information and support.
Absolutely. It's so important to make sure that everyone has access to accurate information and resources, especially those who are at higher risk. Yeah. Public health messaging needs to be tailored to specific communities and their needs.
For sure. And the researchers also pointed out that we're probably dealing with a lot of underreporting of cases, which makes it even harder to track and contain the spread.
That's a common problem with infectious diseases, especially in places where healthcare systems aren't as strong. Right. It shows how important it is to have strong surveillance systems and easy access to testing to really understand the true scale of the outbreak.
Right. And their research involved analyzing samples from over 670 patients.
Wow.
Infected with Mpox. That's a pretty substantial sample size.
It is.
Gives us a lot of valuable data to work with.
It does. And they found that over half of those infected were women.
Oh, interesting.
Which, again, supports the idea that this variant is spreading differently than in 2022. Right. And the fact that they saw cases in healthcare workers highlights the risks that they face on the job.
Absolutely. It's a sobering reminder that we're all connected.
Right.
And the health of one community can impact us all.
Precisely. And this outbreak really shows how important global solidarity and collaboration is in tackling these health challenges. Yeah. We need to share information, resources, and expertise to effectively deal with these threats and ensure everyone's well-being.
You know, it is a pretty bleak picture, but it's also inspiring to see all the research and collaboration happening in response to this variant. Right. It reminds us that even when things are tough, human ingenuity and determination can shine through.
This outbreak is a challenge, for sure. Yeah. But it's also a chance to learn and adapt and improve our global health systems. Right. By working together, we can get through this and build a healthier future for everyone.
So this research from the Technical University of Denmark is a real eye-opener. Yeah. It tells us Mpox is back, it's more transmissible, it's spreading in new ways, and it has these potentially serious consequences, especially for pregnant women.
It really raises the question, how can we, as a global community, effectively respond to these threats and make sure that the people who need help get it?
It's a question worth thinking about.
It is.
We'll keep following this story, and we'll keep you updated.
Sounds good.
But for now, let's dig a little deeper into some of the specific challenges and opportunities.
Okay.
This outbreak presents.
All right. One thing that really stands out to me is the possibility that this new variant could change who's most affected by Mpox. We've seen it spreading through heterosexual contact in really populated areas. So that could mean a whole new group of people are now at risk.
That's a great point. And it makes you wonder, how do we adapt our public health messaging and interventions to reach these new groups effectively?
That's a key question. We need to make sure that information about prevention, symptoms, and treatment is easy to understand and culturally relevant to everyone.
Absolutely. And speaking of prevention, what are some of the best ways to slow down the spread?
Well, based on the research, avoiding close contact, especially sexual contact, in the areas where the virus is spreading is crucial.
Right. So those simple preventative measures can really go a long way.
They can.
And of course, getting vaccinated if you can.
Absolutely. Vaccines are so important for preventing the spread of infectious diseases. They protect individuals and they help create herd immunity, which protects those who can't get vaccinated for medical reasons.
So it's really a group effort.
It is.
It's not just about you. It's about protecting everyone around you.
Exactly. We all benefit when more people are vaccinated. It helps slow down transmission and reduces the overall impact.
This research has definitely given us a lot to think about.
It has.
And it's clear we still have more to learn about this new Mpox variant.
We do, and we need to stay informed and be able to adapt. As new information comes out, the situation is changing constantly. And our response needs to change with it.
We can't afford to let our guard down.
No.
Infectious diseases are a constant threat. And we have to be prepared to respond quickly and effectively.
That's right. This isn't the first time we've faced a global health crisis, and it won't be the last. But if we learn from our experiences and work together, we can overcome these challenges and create a healthier future for everyone.
So this new variant is a stark reminder that we live in a globalized world.
It is.
And that everyone's health is connected.
That's right. It's a call to action for global solidarity, cooperation, and a real commitment to investing in public health.
So we're talking about strengthening those surveillance systems, developing new tools for diagnosis, and speeding up vaccine development.
Exactly. But it's not just about the science and medicine. We also need to address the social and economic inequalities that make some communities more vulnerable to these diseases.
It's about creating a world where everyone has the chance to be healthy no matter where they live.
Exactly. It's about recognizing that health is a human right. And everyone deserves access to quality health care.
So we're not just fighting a virus. We're fighting for a more just world.
You could say that. This outbreak has really shown us the weaknesses in our systems and the urgent need for change.
This research from Denmark, it's a real wake-up call.
It is.
It reminds us we can't be complacent when it comes to infectious diseases.
It can show up and spread so quickly. We need to be ready to respond fast. This outbreak shows how important scientific research, public health, and global collaboration are.
It's a reminder that we're all in this together.
We are.
And what happens in one place can affect everyone.
We need to work together to create a healthier and more equitable world for everyone.
A world where we're ready to face the challenges of these new diseases. And where everyone has a chance to thrive.
It's a tough job. But we can't ignore it. Our health, our future, it all depends on it.
And it's a responsibility we all share.
It is.
Together. We can make a difference.
I believe that.
Now, you mentioned earlier that the Great Life Project played a big role in this outbreak. I'd love to hear more about their work and how they were able to respond so effectively.
Their story is amazing. It's a great example of how investments in global health can really pay off.
Let's dive into that because I think it offers a hopeful perspective. Amidst all these challenges we've been talking about. You mentioned that Great Life was already happening when this new variant appeared.
So what's interesting here is that Great Life was initially focused on building capacity for detecting outbreaks in East Africa.
Okay.
So they were already working with communities and healthcare providers to improve surveillance systems and lab capabilities.
So they had the tools and the expertise.
Yeah.
And they were in the right place.
They were.
At the right time.
They were.
So when this new Mpox variant came about, they were ready.
They were ready to go.
To jump into action.
Yep. They were able to quickly shift their focus and apply their resources and knowledge to this new threat. They played a key part in identifying it, developing a specific test, and tracking how it was spreading.
Their quick response must have been crucial.
It was.
In containing the outbreak.
Absolutely. Their work gave us valuable information about how the variant was transmitted, and that helped inform public health decisions.
It sounds like Great Life is a perfect example of how investing in global health can really make a difference. You never know when or where the next outbreak will be. So having those systems in place is essential.
Yeah, it really shows the importance of being prepared and working together.
Right.
The Great Life Project is a great example of what happens when you have strong partnerships between researchers, healthcare workers, and local communities.
Right.
It's that kind of approach that's so important for dealing with these kinds of threats.
And this brings us back to that point we keep talking about. The interconnectedness of global health.
It's all connected.
This new Mpox variant reminds us that diseases don't care about borders.
Right.
What happens in one part of the world can affect us all.
It highlights the need for a coordinated global response to these challenges. We can't afford to be isolated or complacent. We need to share information, resources, expertise to protect everyone's health.
It's a call to action.
It is.
For governments, organizations, and individuals to work together.
Absolutely.
To share our knowledge and resources and to prioritize global health.
And it reminds us that we're all in this together.
We are.
The health of one community can affect us all.
Absolutely. So let's bring it all back to you, the listener. We've covered a lot today in this deep dive. We talked about this new variant, its unique characteristics, its potential impact. And what we can do to address it.
We've seen that this outbreak shows how important it is to be vigilant and prepared and committed to global health equity.
It's a challenge, but it's also an opportunity. An opportunity to learn, to adapt, and to get better at handling these new infectious diseases.
And to connect this to the bigger picture, it reminds us to be proactive, not reactive when it comes to global health.
We can't wait for outbreaks to happen.
No.
To take action.
We
need to do research. Build capacity. And work together. To create a world where everyone has a chance to be healthy.
That's a big goal.
It is.
But we can't ignore it. Our health, our well-being, our future, it all depends on it.
So what stands out to you from all this? What will you do differently? It's something to think about.
It is.
And as always, we'll be here to keep you informed as we learn more.
So we've talked about the challenges with this new variant, but what about solutions? How do we deal with this outbreak?
That's a great question.
And
I'm really curious to hear your thoughts. Where do we even begin?
Well, one of the most important things is proactive surveillance. And early detection. Think of it like a smoke detector in your house. It's way better to catch a fire early than to wait until the whole place is burning.
I like that. So how do we apply that to Mpox?
You need strong surveillance systems all over the world to watch for anything unusual. This means healthcare providers, labs, and public health agencies all working together.
That makes sense.
We
got to spot those warning signs.
Early. Exactly. And early detection goes hand in hand with rapid response. The faster we find and isolate cases, the better our chances of containing things.
And in this case, with this fast-spreading variant, time is really important.
Every day matters. When you're dealing with an outbreak, the sooner we act, the less damage there'll be.
And by damage, we're talking about lives.
This is serious.
Yeah.
It's already taken lives.
Right.
And if we don't act,
yeah,
it could be devastating for communities worldwide.
So besides surveillance and rapid response, what else can we do?
Well, we've mentioned prevention, and that's key.
Right.
The researchers are urging people to avoid close contact, especially sexual contact, in areas where this variant's spreading.
Right.
I know it's not what people want to hear.
Yeah.
But it's vital information.
It's about being responsible. Right.
Exactly.
Protecting ourselves and others.
Exactly. Even simple things.
Yeah.
Like washing our hands.
Right.
And staying home when sick.
Right.
Can make a difference.
And of course, vaccination.
Yeah, absolutely. Vaccines are one of the most effective tools that we have to stop the spread.
Right.
They not only protect you, but also help create herd immunity.
Right. Protecting those who can't get vaccinated.
Exactly.
So it's a team effort, really.
It is.
It's not just about yourself.
Right.
It's about everyone around you.
Exactly. We all benefit.
Yeah.
When more people get vaccinated, it slows down transmission and lessens the impact.
This research has given us a lot to think about. And it's clear.
Yeah.
We still have a lot to learn.
We do.
About this variant.
We need to stay informed.
Yeah.
And be ready to change as we get new information.
Right.
The situation is constantly evolving, and we need to evolve with it.
We can't get complacent.
Yep.
Infectious diseases are always out there.
Yeah.
And we need to be ready to respond quickly and efficiently.
This isn't our first global health crisis.
Right.
And it won't be the last.
No.
But if we learn from this and work together, we can get through these challenges and build a healthier future.
For sure.
Everywhere.
This new variant really reminds us that we live in a globalized world.
It does.
And everyone's health is connected.
Absolutely. It's a call to action.
Yeah.
For global solidarity, cooperation, and a real commitment to public health.
So we're talking about things like strengthening surveillance systems, developing new ways to diagnose, and speeding up vaccine development.
Exactly. But it goes beyond just science and medicine.
Right.
We also need to look at the social and economic issues that make some communities more vulnerable.
Right. It's about creating a world where everyone has a chance to be healthy.
Exactly. It's about understanding that health is a human right.
Absolutely.
And everyone deserves good health care.
So we're not just fighting a virus here.
Right.
We're fighting for a fairer world.
You could say that this outbreak has shown us the cracks in our systems and the urgent need for change.
And this research from Denmark has been a real wake-up call.
It has.
Reminding us that we can't be complacent about these infectious diseases.
They can emerge and spread so quickly.
Yeah.
We need to be ready.
Right, to respond.
Fast. This outbreak shows us how important scientific research is. Right.
Public health.
Yeah.
And working together globally.
It's a reminder that we're all connected.
We are.
And what happens in one community can affect us all.
We need to work together to build a healthier, more equitable world for everyone.
A world where we're prepared to face these new diseases and where everyone can thrive.
It's a big task.
It is.
But we can't ignore it.
Right.
Our health, our well-being, our future, it all depends on it.
It's a responsibility we all share.
It is.
And together, we can make a difference.
I believe that.
You mentioned that the Great Life Project was already happening when this new variant popped up.
Right.
Can you tell us more about that?
Sure. So Great Life is all about building capacity for detecting outbreaks in East Africa.
Okay.
They're already there.
Right.
Working with local communities.
Right.
Healthcare providers.
Right. To strengthen things like surveillance and lab capabilities.
So they had the tools.
Yeah.
The expertise.
Right.
They were in the right place.
They were.
At the right time.
Perfect timing.
So when this variant emerged, they were ready.
They were ready to go.
To jump into action.
They were able to quickly shift their focus and use their resources and knowledge to tackle this new threat. They played a key role in identifying the variant, developing that specific PCR test, and tracking its spread.
Their quick response must have been crucial.
It was essential.
In containing the outbreak.
It really helped us understand how it was spreading, which informed public health decisions.
So Great Life
seems
like a prime example
of
how investing in global health can really have an impact.
Yeah, you never know when or where the next outbreak will be. So having those systems ready is crucial. It's a powerful example of preparedness and collaboration. great life shows what can happen when you have strong partnerships. Researchers, healthcare workers, local communities.
Absolutely. It's that kind of approach that's so important for dealing with these threats.
Exactly.
And this brings us back to that idea of interconnectedness.
Yeah, it's all
in global health.
Right.
This Mpox variant is a reminder that diseases don't care about borders.
Nope.
What happens in one part of the world can quickly affect everyone. It really underscores the need for a global response to these challenges.
We can't afford to be isolated
or complacent. We need to share information.
Right.
Resources, expertise.
Yeah, to protect everyone's health.
Everywhere. It's a call to action.
It is.
For governments, organizations, individuals to work together. We got to pool our resources and knowledge.
And prioritize global health.
And it's a good reminder that we're all in this together.
We are.
What affects one community affects us all.
Absolutely. So let's bring this all back to you, the listener.
All right.
We've covered a lot of ground today.
We have.
We explored this new variant. Its characteristics, potential impact, and the steps we can take
to address it.
We've seen how important it is to be vigilant, prepared, and committed to global health equity.
It's a challenge for sure. It's also an opportunity.
Right, an opportunity to learn.
And to adapt.
To get better at handling
these new infectious diseases.
And if we think about the bigger picture, it reminds us to be proactive.
Right.
Not reactive.
We can't wait for outbreaks to happen to start taking action.
We need to invest in research. Build capacity, work together.
To create a world where everyone has a chance to be healthy.
It's a big goal.
It is a big goal.
But we can't ignore it.
Our health, our well-being.
Our future depends on it.
So what are your takeaways?
What will you do differently?
It's definitely something to think about.
It is.
And as always, we'll be here to keep you updated
as we learn more.